Thank you for watching. We're so excited you're here to learn how to stay healthy during pregnancy. For more helpful tips and weekly videos, please subscribe and hit the bell icon to stay updated. Today, we're diving into how to control diabetes and pregnancy expert advice. You'll discover what you need to know to keep you and your baby safe. Let's jump right in. Gestational diabetes, also called diabetes in pregnancy, happens when your body can't produce enough insulin to manage blood sugar levels. This usually occurs around 20 to 24 weeks of pregnancy. Hormones from the placenta, like human placental lactogen, make your body more resistant to insulin. This causes blood sugar to rise. Think of insulin as a key that unlocks sugar for energy, but during pregnancy, that key doesn't work as well. If not managed, gestational diabetes can lead to risks. These include a larger than average baby, known as macrosomia, premature birth, or preeclampsia. Preeclampsia is high blood pressure that can be serious for you and your baby. The good news? With early action, you can manage gestational diabetes. According to the American Diabetes Association, most women control it with diet, exercise, and sometimes medication. Today's video is all about how to control diabetes in pregnancy expert advice, so let's explore what you need to understand. Some signs of gestational diabetes might feel like normal pregnancy discomforts, but they shouldn't be ignored. For example, you might feel thirstier than usual, even after drinking plenty of water. This happens because high blood sugar makes your body flush out sugar through urine. This dehydrates you, so you're reaching for water all day, maybe even at night. Another sign is frequent urination. High blood sugar makes your kidneys work harder, leading to more bathroom trips. Pregnancy already increases urination, but waking up multiple times at night to pee is a red flag. Fatigue is also common. If you're exhausted despite resting, it could be because your body isn't using sugar effectively for energy. Blurred vision might happen too. High blood sugar can affect the fluid in your eyes' lenses, making things look fuzzy. Lastly, genital itching or frequent infections like yeast infections can occur. High blood sugar creates an environment where bacteria thrive. If you notice any of these, don't panic, but don't ignore them either. Eating for gestational diabetes means choosing low glycemic foods to keep blood sugar stable. These include whole grains, vegetables, and lean proteins. Swap white bread for whole grain bread or sugary snacks for berries. A sample breakfast could be oatmeal with almonds and a sliced apple. This keeps you full and your blood sugar steady. Lunch might be a grilled chicken salad with lots of greens, avocado, and a light vinaigrette. For snacks, try Greek yogurt with a handful of nuts or carrot sticks with hummus. Avoid processed foods like sugary cereals or sodas, as they cause quick blood sugar spikes. Aim for balanced meals with fiber, protein, and healthy fats. Fiber slows sugar absorption, so include foods like broccoli, lentils, or quinoa. Portion control matters too. Eating smaller meals every 3 to 4 hours helps prevent spikes. A dietitian can create a personalized gestational diabetes diet plan, but these basics work for most moms. Pair this with hydration. Drink at least 8 to 10 glasses of water daily to support your kidneys and overall health. So, what should you do if you notice these issues or want to manage gestational diabetes? First, talk to your doctor right away. If you spot signs like thirst or fatigue, they'll likely recommend a gestational diabetes test, usually between 24 and 28 weeks. This test involves drinking a sugary solution, and they check your blood sugar after an hour or two. Keep a journal of your symptoms or habits. Note how often you're thirsty, how much you're peeing, or what you're eating to share with your doctor. This helps with a better diagnosis. You can also start healthy habits now. Eat smaller, balanced meals every few hours to avoid blood sugar spikes. Walking for 20 minutes a day or doing prenatal yoga can help your body use insulin better. These are safe for most pregnant women, but always check with your doctor first. Staying hydrated is key too. Avoid sugary drinks like sodas or sweetened teas, and stick to water or unsweetened herbal teas. Getting enough rest also supports your body's ability to manage blood sugar. Let's talk about the gestational diabetes test in more detail. The glucose challenge test is a common screening tool. You'll drink a sweet liquid containing 50 grams of glucose, and after an hour, your blood sugar is checked. If it's high, you'll do a follow-up test called the glucose tolerance test. This one's longer. You fast overnight, then drink a 100-gram glucose solution, and your blood sugar is checked multiple times over 3 hours. It's not fun, but it's important to confirm a diagnosis. If diagnosed, don't worry, you're not alone. About 2 to 10% of pregnant women in the US develop gestational diabetes, according to the CDC. Your doctor might refer you to a dietitian or diabetes educator to guide you. Some women need insulin or oral medications like metformin if diet and exercise aren't enough. These are safe for pregnancy when prescribed, so trust your healthcare team. Exercise is a game changer for managing pregnancy diabetes risks. It helps your muscles use glucose, lowering blood sugar naturally. Walking is great. Aim for 20 to 30 minutes most days, even if it's just around your neighborhood. Prenatal yoga or swimming are gentle options that also reduce stress. Stress can raise blood sugar, so try relaxation techniques like deep breathing or meditation for 5 to 10 minutes daily. Avoid high-impact activities like running, unless you were already doing them before pregnancy. Always listen to your body and stop if you feel dizzy or uncomfortable. Pair exercise with a consistent sleep schedule. Aim for 7 to 9 hours per night. Poor sleep can mess with insulin sensitivity, so prioritize rest. Let's bring this to life with a story. Imagine Emma, a 30-year-old mom who noticed she was thirstier than usual during her second trimester. She thought it was just pregnancy. But when she started waking up 3 times a night to pee and felt exhausted, she told her doctor. They ordered a glucose test, and Emma was diagnosed with gestational diabetes. She worked with a dietitian to eat low glycemic meals. She chose quinoa with veggies and grilled chicken for lunch and walked daily after dinner. Emma also kept a food and symptom journal, which helped her doctor adjust her plan. By delivery, her baby was healthy at 7 pounds, and her blood sugar was under control. Emma's story shows that taking action early can make a big difference. You can take charge of your health too. Monitoring your blood sugar is another key step. If diagnosed, your doctor may give you a glucometer to check your levels at home. You'll typically test fasting blood sugar in the morning and after meals. Normal fasting levels are usually below 95 milligrams per deciliter, and post-meal levels should be under 140 milligrams per deciliter after 1 hour or 120 milligrams per deciliter after 2 hours. Write down your readings to share with your doctor. This helps them see patterns and adjust your diet, exercise, or medication if needed. Don't feel overwhelmed. Checking takes just a few seconds once you get the hang of it. Many women find it empowering to track their progress and see improvements. What about pregnancy diabetes risks for your baby? Uncontrolled gestational diabetes can lead to macrosomia, where your baby grows larger than average, making delivery harder. It can also increase the chance of low blood sugar in your newborn or breathing problems. Long-term, your baby might have a higher risk of obesity or type 2 diabetes later in life. But here's the reassuring part. Managing your blood sugar significantly lowers these risks. A healthy diet, regular exercise, and following your doctor's advice keep both you and your baby safe. After delivery, gestational diabetes usually goes away, but you'll need a follow-up test 6 to 12 weeks postpartum to confirm your blood sugar is normal. You're also at higher risk for type 2 diabetes later, so keep up healthy habits. Let's address some common worries. Many moms fear gestational diabetes means they did something wrong. That's not true. It's caused by hormonal changes, not your lifestyle. Family history, being over 25 or having a higher body weight can increase your risk, but it can happen to anyone. Another concern is whether it's safe to breastfeed. Absolutely. Breastfeeding is not only safe but can help stabilize your baby's blood sugar and lower your risk of type 2 diabetes later. If you're feeling stressed about managing gestational diabetes, connect with other moms. Online groups or forums can offer support and tips from women who've been there. To wrap up, today we covered how to control diabetes and pregnancy expert advice. You learned how to spot gestational diabetes symptoms, like thirst, frequent urination, and fatigue, and how to manage them with a gestational diabetes diet, exercise, and monitoring. We also discussed the gestational diabetes test and pregnancy diabetes risks, plus practical steps to stay healthy. We're here to empower you with clear, reliable advice for a healthy pregnancy. Comment below. Have you noticed any symptoms or tried these tips? Let us know. Subscribe for more videos on gestational diabetes symptoms, diet, and tips. Check out our playlist on gestational diabetes management for more ideas. Follow us on Instagram for daily pregnancy health tips. Always consult your healthcare provider for personalized medical advice. Thanks for watching and see you in the next video.